So today I'm going to be administering some medications to my patient. So the first thing that I would do would be to review the doctor order and just look at the medications. So the two medications that I'm administering today are digoxin and heparin. Digoxin increases the contractility of the heart, and heparin causes platelets to coagulate less quickly, so it's considered a blood thinner. So I would just research that, the action, and then I would do the test that I would be required to do before administering those medications. So for digoxin, I would get an apical pulse for 60 seconds and just ensure that that is over 60 beats per minute. And then for heparin, I would do a blood panel and just make sure that they have over 150,000 level of platelets. So after I do all that, then I would come over to the medication, the med dispense, and get my medication. Okay, so now I'm going to be pulling my medications out of the med dispense. The first medication I'll get is digoxin, and it comes in a 0.25 milligram tablet, which that's how much we're going to be giving the patient today, so that's perfect. I'll select that, say that I want one, and then I'll just do my first check here, going through my 5 rights, so the right medication, the right dose, the right route, the right patient, and the right time. And then I'll also just make sure that the medication is not expired and that it is what I want. So I've got that. Okay. Now I'll get heparin. So this heparin comes in 10,000 units per milligram, and we're only going to be giving 5,000 units today, so I would have to calculate that I'm only going to be giving a half milligram or milliliter. Okay? So let's see. So again, just checking here, just making sure it's not expired and it is the right medication at the right dosage. So I've done that. Okay, and I'm just going to gather all the supplies that I need. So I have gloves, I'm going to get an alcohol swab, I'm going to get a needle that I'll do the subcutaneous injection with, I'll get a cup for my pill, and some water for the patient to drink, and now I'm ready to go over and prepare the medication. Okay, so I've washed my hands, and now I'm going to prepare my medications outside of the patient's room. So first thing I'll do is just do my second check here with the digoxin and make sure that it is the right dose, compare that with the order, right dose, right medication, right route, right time, all of the rights. So I've got the right thing there. Now I'm going to prepare this heparin. So I'm going to be giving a half a milliliter. So I'm going to first clean the top of the heparin. Let that dry, and I've aspirated a half milliliter. So I'll first check that. Just make sure there's no air bubbles or anything. Everything looks good. I've got the right dose there. Now I'll withdraw and recap my needle. And now I'm ready to go into the patient's room. Okay, so now I'm going to administer these medications. So I'll walk into my patient's room, introduce myself to the patient. Hello, my name's Scott, and I'm going to be your nurse today. Today we're going to be giving you your medications, but first could you please state your first and last name and date of birth, please? So I would just confirm that with the wristband, and then scan it. Okay. Now I would ask about the patient's allergies. Okay. So the patient is allergic to penicillin, however that's not applicable to what I'm administering today. So now that we've gotten all that out of the way, we can provide privacy to the patient, and I will start getting my medications ready. So the first medication that I'm going to be giving you is digoxin. That is going to help your heart beat more strongly because you have some issues with your heart. However, if you do start to feel weak or tired, just go ahead and hit that call light, and I'll be checking on you 30 minutes from now after I administer this medication anyway. So I'm going to scan my digoxin, doing my third check here. Just make sure that I have the right medication, right dose, right route, right time, and right patient. Okay, so I've got all that. I'm going to put my tablet in the cup, and then I'll just give this to the patient here. So give the patient the pill, and then a sip of water. Okay, just make sure all that went down okay. Now I'm going to administer the heparin to the patient. So the heparin is the medication that helps with your blood clotting. So sometimes your blood clots too much. This will just stop it from clotting too much. Now if you do start to feel weak, or you have a cut that just won't stop bleeding, or excessive bruising, just let me know, okay? So now I'm going to scan the heparin, and then also do my third check on that, going through my 5 rights. Okay. Now I'll don gloves for this procedure. I'm going to be injecting this into your abdomen subcutaneously. Okay. I'll find a good spot there.
Okay, so let's start here because I think I got it.
I'll clean that spot with alcohol.
Could you see me uncapping the needle?
Okay, make sure that dries.
I'll just
Get a new alcohol swab,
let's just start here.
or gauze if I have one.
No, I know, I'm just talking about like no,
Okay, so
don't
I'm going to make sure that this is dry,
to be really fluid,
and then
between takes.
pinch a little bit of the tissue so that way I'm only injecting into the subcutaneous fat. So on the count of 3, I'm going to inject. 1, 2, 3. Okay.
Needle, 2 inches of tissue before I start to go in 90-degree angle. Tissue.
And I cover that up with my gauze. I'm going to make sure I apply the safety device to the needle and put it in the sharps container. So I'll put it over there in the sharps container. And then
Immediately.
just make sure that there's no bleeding or anything.
Very important.
And now I'll just make sure that the patient's feeling okay. Are you feeling okay after taking those 2 medications? Just make sure they're okay. Make sure their call light's within reach. And then I would just inform them that I will be back in 30 minutes to reassess them. And before I leave, I'll make sure I reassess that their abdomen is not looking abnormal anyway. And I'll cover them back up. Make sure that their rail's up. The head of the bed is elevated because I just gave an oral medication, and that the bed is in its lowest position. And then I will take my gloves off, throw those in the trash, and perform some hand hygiene. Okay, so now that I have administered the medications, I'm going to perform hand hygiene and document the administration. So for my digoxin, I administered 0.25 milligram tablet orally. And before I did that, I assessed their apical pulse, and it was greater than 60 beats per minute. And I administered it at this time, but I would also make sure that I reassess 30 minutes from now. And then for the heparin, I administered 5,000 units subcutaneously in the left lower quadrant of their abdomen. And I made sure that before I did that, that they had more than 150,000 platelet count, and that the patient responded well to this medication administration. So I'll just make sure that I document all of that, and I make sure that I return these medications to the med dispense, and make sure I come back and check on my patient 30 minutes from now. But as of right now, I'm done.